Hi guys, and welcome back to my channel. First off, I'd like to apologise because my fan has just started to go off. It's like a heater thing that I have in this room, and typically as soon as I switched on the camera it started to go off, and I thought, do you know what, should I stop filming or should I just get on with it? Let's just get on with it. So this is my postpartum video. It is now, how many weeks? 4 weeks. 4 weeks postpartum, so 1 month postpartum. I know we didn't do any meet the baby kind of videos. I apologise for that. Unfortunately, some things did happen since giving birth, so I couldn't, and I'm about to explain all of that now. So you saw my labour video, and she was born on the 27th of November, and I can't even remember the time she was born. That's terrible, isn't it? My mind, one thing I've carried over from pregnancy to post-baby or post-pregnancy is my memory loss, and I can be halfway through a sentence and I can still just completely forget what I'm talking about. So I've carried on my pregnancy brain straight into baby brain. So basically, when I was in labour, they fully expected me to hemorrhage, and everything was set up for that scenario happening, but luckily it did not happen. It actually went very, very smoothly. So we thought. So after I had Darcy, I was moved on to a ward, and unfortunately when I was on that ward I started to bleed, and it wasn't uncontrollable, it wasn't a massive amount, it was just bleeding. So they moved me down the hall into a private room, and my bleeding was monitored, and thankfully it didn't go any further than that. It was very well controlled and I was okay. So I left hospital, I think it was 1 day after I'd given birth, 24 hours afterwards, because they had to do different checks on Darcy. As I was taking medication for my blood pressure, they had to keep a check on her blood sugar levels, as obviously when you take a blood pressure medication during pregnancy, it can cause their blood sugar levels to drop once they are born. So she had to be monitored every couple of hours or every hour to make sure that was okay, and I was quite happy for that to happen. Obviously we all want the best for our babies. When it came to going home, I unfortunately had a very random panic attack, and I felt like I couldn't breathe, and all the time that I was in the hospital I felt like I couldn't breathe, and I kept telling the midwives that I was very breathless and my chest was very tight. But they kept telling me that it was nothing to worry about. So I went along with that and assumed nothing was wrong. When it came to going home, I still had this breathlessness, and over the course of 24 hours it started to get a little bit worse. And my tummy didn't feel quite right. Something didn't feel quite right. So I kept an eye on it. I rested up as much as I could. It was just me and Darcy kind of in our bedroom, and we didn't really go anywhere, see anybody or do anything. It was just, we were kind of confined into this one space. Getting up and down the stairs became very, very painful and very difficult because I couldn't breathe. And then I had a meeting with my midwife at home, and she had a feel of my tummy, and it was just so very unbearable that she had to stop. And she advised me that if the breathlessness started to get worse, I was to phone into the labour ward immediately and just, you know, get myself there and get sorted out. But she did have a hunch that maybe I was anemic, or maybe I was retaining product inside of my uterus. So I was to keep an eye on everything basically. And then within hours of seeing her, I passed what looked like membrane, like a part of the amniotic sac, and it looked like it was retained, and it wasn't small, it was quite a large piece of membrane that I'd passed. And the bleeding became very reluctant to leave my body. It just kind of, it wasn't slowing down, it wasn't getting heavier, but it wasn't slowing down, and then I started to clot quite badly. So I called our labour ward straight away, and she wasn't concerned at all about what was going on. with my uterus area. She was more concerned with the fact that I could barely talk to her because I couldn't catch up with my breath. And I was, all the way through a sentence, I was just kind of running out of air as I was talking. And it got worse, and it started to get a bit scary. And she said to me on the phone, I really don't want to scare you, but we have known to lose mummies because of having a blood clot into their lungs. And I was to get myself to our accident and emergency department immediately. So I did that. I called my mum. My mum came running around. At this point, I was frantic. I was absolutely frantic. I was terrified that something was going to go wrong and I wasn't going to be here for my babies. And it scared me, and I couldn't stop crying, and I couldn't calm myself down. But the 2 and 2 together, not being able to breathe already, and then going into a massive panic, I just couldn't breathe at all, and I started to get very, very dizzy, and I couldn't steady myself on my feet. And my husband called for an ambulance to come and get me. By the time they got there to my home, my blood pressure was really high. As soon as he checked it, the first time he checked it, it was 175 over 117, and it just kept climbing from there, and they couldn't get it to come down. My oxygen levels were perfectly normal, so he didn't really know what was going on at this point. Again, I was very frantic and I couldn't breathe, and it felt as though somebody had tied something very tight around my chest. And every time I tried to get off the seat, I couldn't focus my eyes. I didn't feel okay at all. So they had to literally take me out to the ambulance themselves. And we sat in accident emergency for quite a while. They did multiple different tests. I had chest x-rays, I had blood tests, I had ECGs, I had urine tests, I had, what else did they do? They did lots of different weird things, and they were very professional. The only thing is unfortunately the doctor I had so much of an accent I couldn't understand much of what she was saying, and I kept having to ask her to repeat, and I felt so rude for doing so, but I really wanted to understand what was going on. So my chest x-rays came back completely normal. There was no fluid in my lungs. They didn't suspect that I had a blood clot. I was already taking Clexin, which is an injection into the stomach to stop any blood clotting after you have given birth, and I think it is now standard practice for all mummies to have that after they've given birth. But what did show up in my blood tests was that I was showing an infection, but they couldn't pinpoint where this infection was. So I was to immediately get back to my GP, so the GP could then, I think it was to plan further tests. They wanted me to have an echo scan on my heart to make sure that everything was going okay with my heart. And it also showed up in my blood test that my liver enzymes were far too high. Now, sometimes this can be an effect of pregnancy, but because of how high they were, she wanted me to have further testing to make sure that it was nothing sinister that was going on outside of pregnancy. Obviously, I am overweight, so it could be a factor, or it could be that I have high cholesterol. We don't know yet. I'm still undergoing tests for that. I'm still waiting for the results. I actually have to call tomorrow to see if they're back. So I will let you guys know how that goes when I get them. So yeah, I went home and I still didn't feel quite well. I had a sore throat, my head was pounding, I was shivery, I had fevers, I just wasn't okay. And then it came to light that I had in fact formed sepsis. And it wasn't terrible, it wasn't a terrible case of it. Straight onto the antibiotics, took the antibiotics, and I was doing miles better. And unfortunately, at the same time that I had sepsis, my sister, who was pregnant with her first baby, came down with sepsis. So it was almost like we had sisterly sepsis. It was just a very odd situation. And the thing is, I couldn't concentrate on my own health, because I was so very worried about her and her little unborn baby, and I just wanted her to be well. And I kind of, in the process, forgot to take care of myself, if that makes sense. I didn't see her the time that she had sepsis, but I was on the phone constantly, messaging her constantly. I was so very worried about it, and I think I drove Kevin a little bit mad, because all I was talking about was her health and how worried I was about her. But again, whilst I was unwell, I was kind of zooming around and trying to do the night shift with Darcy and the day shift with the children, and it just wasn't working. And it came to a point where I was running myself into the ground. The paramedic actually mentioned to me that he thought I was suffering with something called burnout, and I've never heard of that before. I didn't know what it was, but because I was literally trying to do everything, I was basically burning myself out, and I still haven't quite caught up from the sleep that I lost in that time. So I'm still very, very tired, and I'm still, obviously, Kevin has been really helpful. He's doing some night shifts, I'm doing some night shifts, but I kind of have this thing, I feel like, and it's such a silly thing because a dad is not a babysitter, he is a dad. I just feel like she's kind of my responsibility, and I should be taking care of her, and I shouldn't put that on him, even though I know he doesn't really mind doing it because he is dad. But I think it's just a thing that I have created in my own mind, that I have to do everything and I can't be superwoman. It is a situation that we are currently working on. I'm trying to just kind of give up a half of the motherly duties of doing nighttime feeds and things like that, and trusting him to do it. And there is absolutely no reason why I shouldn't trust him to do it. It's just, I think it's just a motherly protective nature that I don't want anybody to touch her. We did have a bit of a chat with my midwife at the time of all this started happening, because everybody kept saying to me, have you thought maybe you have postnatal depression? And in my mind, postnatal depression was you reject your baby, you can't cope, you cry all the time, you know, you kind of get a little bit bad-tempered and you have some nasty thoughts, things like that. That was how I saw postnatal depression, and I was so very ignorant to it. Because when I sat and spoke to my midwife, she explained to me that there is two sides of postnatal depression. You can be, you know, the tearful, not bonding with your baby mummy, or you can be the one where you don't allow anybody to touch your baby at all. And that was very much how I became. I didn't want anybody touching her, I didn't want anybody holding her, I didn't want anybody looking after her at all. I became to a point where I sat holding her constantly because I didn't want anybody to touch her. And I never knew that that could be a part of postnatal depression. I just thought it was a new bond, a new love that a mummy has for her child. But yeah, so they advised that if it were to get any worse and I couldn't break the cycle of wanting to be on her all the time, then I should definitely go and talk to my doctor and see what they suggest that I do. But I started a little while ago. It just kind of got better, and I started trusting people to hold them. You know, my sister came round, I let her hold her. We had friends come round to see her, to meet her, and I let them hold her. Although it did kind of break my heart a little bit that I was passing her around to all these people, I still did it for my own mental health. And now I feel completely comfortable with, you know, my sisters, my mum, friends giving her a cuddle. I'm right there, so nothing's going to happen. Kind of had to drill that one into my mind a little bit. But I'm still going through the worries of, what if my husband fell asleep and he's got hold of her? What if she got too cold through the night? What if she was sick through the night and she didn't turn her head? I'm working on that bit still. I think I read too many horror stories online and I've kind of scared myself a little bit, so I'm working on all of that. As for my health at this point, I still have a few things that are going on. Again, I'm still waiting for test results for my liver enzymes. I'm waiting for test results as well on my B12 levels, because I've been very, very tired. I know I get very tired from being up with baby, but this is kind of it's a little bit exaggerated. I get to the point where I'm kind of a little bit woozy on my feet, and it feels more than just normal tiredness. And I keep getting a vibrating sensation in my legs, which again goes hand in hand with a B12 deficiency. So I'm waiting on the test results for that, so I can kind of get back on form. And I have to change my diet and things like that, because quite frankly, whilst I have been going through all of this, my diet has not been great. It's just kind of a grab what I can when I can and put it in my face. So yeah, I think that's basically all that's been going on. My tummy area has withdrawn quite quickly. My uterus has gone back to normal size. I am still dealing with some internal bruising around my pelvis, which, you know, it was my 6th baby. I figured that it wouldn't just kind of bounce back straight away. I figured it would take time. So it is a little bit tender, but it's nothing that I can't handle. When I'd given birth, I couldn't lift my left leg up. The birth I had was very traumatic. It was very painful. It was all down my left side in my hip. And the midwife that helped me deliver, she was massaging my hips and trying to move the baby over, because she was in a position where she was pressing on things that she shouldn't have been pressing on. And it was all so very painful. It was by far the worst pain I've ever experienced in my whole entire life. And I have experienced some pain, so that is saying something. But yeah, after I'd given birth, I realised that I couldn't work my left leg the same as I did before. I couldn't lift it up, I couldn't put any pressure on it and my weight on it. I couldn't carry it on that leg, and it's taken a while for that to go back to normal. I still get times, if I've been on my feet all day, I still find that I can't lift this leg up. So it's maybe something I will talk to my doctor about if it continues, and maybe some physiotherapy to go along with it and help that. But yeah, so apart from a major lack of sleep and a few things going on that I'm waiting test results for, I think that's about it. There's not much really to report other than all of my health issues. I'd love to say that I'm feeling great, but at the moment I'm not. I have had a lot of complications. I did put my makeup on today, however. I am in my pajamas. I will tell you that. I know it looks like I'm wearing a shirt, but I'm not. I'm wearing my pajamas. That is how tired I am. So I will stop babbling now, because this video is getting so long. And if you did like this video, or it was educational to you in any way, then please give it a thumbs up. If you have any questions to ask, or any videos that you want to suggest, or anything you just really want to shout at me, then please put it in the comments box below and I will get back to you straight away. And if you are new here, then please hit that subscribe button, and remember to press the little bell next to the subscribe button, and you will get a notification every time I post a video, so you don't miss out on anything. So I love you guys. Thank you for watching. I will speak to you all soon. Bye for now.